today, and Margaret, you just tell us about how you felt before we started correcting your posture on your spine. Tell me what you were feeling.
Okay, well, I had been coming here for quite a few years just for general maintenance.
Yes.
And then in the last probably about a year and a half, I was having more indigestion problems and feeling a little bit tight in my ribs, and didn't know that it might be related. And so about 6 months ago, I had some extra x-rays done, and it showed that some things in my ribs had changed, and that my spinal cord wasn't as straight as it had been.
Right. Okay. Yeah, Margaret was a patient of a colleague of ours who worked with us, and we inherited her when he retired. Mm-hmm. And so then we reevaluated everything, and so there was some changes that needed to be made because there was compression really on her rib cage because of the shape of her mid-back. Mm-hmm. So we progressed through a treatment plan. We changed what her treatment was, and after doing that, what did you experience?
Okay, well, at first, I don't think anything happened for a few weeks, but my head had gone forward because of an accident that I'd had, so they had to work on the position of my head and also my ribs and the middle part of my back. But I would say after about a month, I began to feel better, and the indigestion began to go away.
Okay. Yeah, indigestion, and you had back pain too, right? That mid-back area?
I had back pain, and I had a lot of popping where it would go in and out.
Yeah.
And I've had that for a long time.
Yeah. And didn't you have some difficulty breathing?
A little bit, yeah.
Okay.
A little bit at the top part of my ribs.
Yeah, because I remember you saying that your breathing was easier.
Mm-hmm. Yeah.
And the indigestion was better. So as far as the treatment, was it painful at all?
Well, I think I have a high tolerance for pain, so for me it wasn't bad at all.
Right.
In fact, I enjoyed the challenge of it.
Yeah.
And actually, after about a month of it, I actually felt taller. I seemed to feel taller. And I teach piano lessons, so I'm sitting by students, and a lot of times I have to bend over a lot to show them, which probably doesn't help my condition, but I didn't have the pain that I'd had before.
Okay, great. And did you have to wait long usually for treatment?
No, not at all. I got right in.
Good. And how was the staff? Were they friendly and courteous?
Very friendly. I love working with the women, and Dr. Hodges is very kind. So.
Oh, thank you. Is there anything else you would like to add to anybody who might be considering getting some kind of alternative treatment for whatever problems might ail them?
Well, I've taken a business card to quite a few people, and I have lots of friends that could be helped by your services, and I would highly recommend your work.
Well, we appreciate that. Do I have your permission to use this with students, doctors, and patients for educational purposes?
Absolutely.
Thank you so much.